Hey guys, just a really quick video on sutures. These are Vicryls and they're usually purple. PDS are usually gray. This isn't the best looking general cart, but anyways, prolines are usually blue. Silk are these light blue. The bonds are orange. I don't know why that's there. It should be here. And then nylons are green and monochrolls are orangey colors. So here's the anatomy of Vicryl sutures. You can see a bunch of numbers in here and it could be a bit confusing, but the 2O number here, it is the size of the thread, okay, like the circumference of it and how thin or how thick it is. And this is the length in 27 inches. And then it will tell you here if it's coated and Vicryl, that's the name. And then the violet braided, it means if it's dyed or undyed. So this suture would be purple versus this, it will be white. Some surgeons like undyed better because they don't like Vicryls poking out of the skin. And the size of the needle is this one. And SH means also the size, and this one just says like the millimeter of it, you know what I'm saying? And taper means that's the tip of the needle and what it looks like if you were to look at it in the front. If you compare on this one is more diamond shaped because it's a reverse cutting needle, you know what I mean? So if you compare the size of the needle, SH and PS2, PS2 is more thinner, and some surgeons like to use this on skin, while this one they usually use it for fatty tissues, like closing, like in vascular surgery. My surgeon uses this 2O-SH for delicate areas, and he uses this specific suture versus this one. And if you go even farther, the bigger, the thicker the needle. You see that? They're all 2Os. It's the same threads, thread size, same length, but different needle and different millimeter on each. You see? And this is taper, reverse cutting, and taper. So when you ask your nurse, what needle do you want? And the surgeon says, oh, I want a 2O Vicryl. You just be like, oh, what needle do you want it on? And they'd be like, okay, I want a CT2. Then there'll be this one. And if you know your needles, you don't have to ask them what needle they want. And if you just memorize what SH is used for, or PS2, CT2, and if they say, for instance, I want a 2O Vicryl on a big needle. Well, what do you know about 2O Vicryls with big needles? There's usually this bigger needles for 2Os. This is the biggest needle, CT1. So you have your nurse, okay, I want a 2O Vicryl on a CT1 needle. Then they will open this. Okay, I want a 2O Vicryl on a small needle, undyed. Okay, so small needle, undyed, that will be 2O Vicryl on a PS2 needle, undyed. Make sense? I know it can get really, really confusing, and there's gazillion sutures, but all you really have to do is to know your needles, your types of needles. And let's see on this side. All that basic knowledge applies to every single one of these sutures. This is the circumference of the thread, the length, the type of thread it is, the needle, type of tip, and the type of needle. If it's thin or short or long or whatever. These nylons are usually used in ankle procedures. 4O monochrome, usually PS2, is usually for skin, for laparoscopic cases when they close the skin. And silks are mostly used for vascular surgery, for vessels to tie them up, usually these ones. And for prolines, these are very, very tiny. There's a 6-0 BV1. 6-0, it's a very, very, very tiny needle, because the more higher you go, the littler the needle is. I mean, the circumference of the thread, I mean. So 5/0s, so these are very thin, like fine thread. You see that? It's kind of like your hair. So if this is 5/0, imagine a 6/0 thread. It's even tinier than that. So that's what it is. And every time you open a needle, make sure that it's not expired. Okay? I know it takes a while to know all this, and I'll get into more detail in another video.